So, good evening, all of you, and welcome to the PCOS series. Today, we are going to learn about the one important diagnosis. Okay, when PCOS is there, or maybe infertility, or maybe any other issues. Nowadays, women are facing these issues, and this session is going to be in most of the time Telugu and English also. So, myself, Padma Kati, I'm a holistic nutrition coach and also naturopath. So today our um, topic is endometriosis. So nowadays everyone is listening as a endometriosis. Means in 10 of the women, if we are taking 100 members of women, at least above 60% are women having these issues. And they are also having this issue with unknowingly, because the diagnosis maybe sometimes it will take the later diagnosis, or maybe sometimes they are not recognized the symptoms and signs. So just we want to create this awareness before going into the third stage. In first stage only, if we can recognize, we can diagnose it. So at least we can reverse, otherwise we can prevent the progression of the endometriosis, and this is the very underlying cause of the endometriosis. Right? So in past five sessions, we are taken the PCOS. So now here we are giving these sessions freely. So if anybody want to heal yourself, so you can use all those sessions, make a notes and go through and apply on yourself, because all these sessions are, if we are taking the money, they are giving other knowledge, and these three sessions are not giving means complete knowledge, not like that. In these sessions also we have given the complete, wholeheartedly we are given the complete knowledge. Just go and apply. If you are feeling like that मेरे साथ नहीं हो रही है, so then contact to our team and myself also. So just now I am going to share the screen. Today time is not very and screen sharing also, that is showing in different way. So I hope everyone see the screen. If someone is watching on the YouTube, just share this knowledge to other person. You don't know how many of women are suffering these issues unknowingly, because knowledge and awareness is very important to diagnosis this process, because most of the women will consult a gynecologist doctor or maybe dietitian coach. So after so many years of suffering, they can connect with these people. So look at here endometriosis and understanding the endometriosis. So why we need to understand? Because understanding is the main important thing in this diagnosis process. So first today we are going to learn in this session very important, that is the causes, symptoms, diagnosis and management. I am not mentioned here reversible, because sometimes it is reversible, sometimes we can stop completely on the progression of this condition. But reversible is also possible, but that is depending on the condition. Okay, where which condition they have. And look at the pic. So how beautifully uterus, fallopian tubes, right, is aligned. But look at that red, okay, fallopian tubes की जो बाजू में है, patches that we can call the endometriosis, means red color की जो patches है. And one is the womb lining है, womb uterus है, ovary, vagina, neck of the cervix है. But जो fallopian tubes in the left side में जो है, right, red color वाला, that one of the section, that is the patches of the endometriosis, means when they are diagnosed, It look like that. So now we are moving. First, we need to understand the what is the definition of the endometriosis. So when we are diagnosis, when someone is diagnosed with the endometriosis, just they can write the she is diagnosed with this thing. When they can do the UGC abdominal scanning and anything, but before going that, we need to understand the what is the definition of the endometriosis. The presence of endometrial tissue. राइट एक पिक्चर इधर काटा हुआ है प्रेजेंस ऑफ एंडोमेट्रियल टिश्यू एक टिश्यू होती है बोथ ग्लैंड्स एंड स्टोमा वी आर नॉट गोइंग इनटू द डीपर इन द फिजियोलॉजी द आउटसाइड द यूट्रस जो आउटसाइड की यूट्रस होती है so that is we can call the endometriosis because that tissue name is we can call the endometrial tissue and that is made up of with the glands जो हमारा हार्मोन जो ग्लैंड्स होती है उसके साथ एंड एक स्ट्रोमा वो टिश्यू होती है उसके साथ दोनों के साथ बनती है and tissue is morphologically and functionally similar to the endometrial tissue है two types okay one is the response to the hormones in a cyclical manner two types होती है one is the hormones का जो हमारा periods की होती है those period మన యొక్క పీరియడ్ ఉంటుంది పీరియడ్ సైకిల్లో ఎలాగైతే రిఫ్లెక్ట్ అవుతుందో అంటే సైకిల్లో హార్మోన్స్ తో పాటు మనం సెకండ్ సెషన్ లో కూడా తెలుసుకున్నాం ఫిజియాలజీలో ల్యూటియల్ ఫేజ్ ఓకే అండ్ ఫస్ట్ ఫెలోపియన్ ట్యూబ్లార్ ఫేజ్ రెండు ఫేజ్లలో ఆ ఫేజులతో పాటు హార్మోన్ సైకిల్ ఎలా వెళ్తుంది అనేది తెలుసుకున్నాం కదా సేమ్ టూ టైప్స్ ఆఫ్ ఎండోమెట్రియోసిస్ లో దట్ విల్ ఎఫెక్ట్ దిస్ టూ cycle one is the hormonal cycle and one is the tissue means that is same morphologically looks like with this endometrial tissue only. And second very important thing is where these are affected, which area. Because this will be affected in inside and outside means uterus के अंदर है and other organs also they will be affected. Most of the members they don't know where they are affected because this is a tissue, right? So tissue అనగానే మన కణజాలం అనగానే గ్లాండ్స్ తో కూడినటువంటి కణజాలం యుట్రస్ లోనే కాకుండా ఓకే ఫెలోపియన్ ట్యూబ్స్ లోనే కాకుండా బయటకు కూడా ఎఫెక్ట్ అవుతుంది అనమాట ఏ ఆర్గన్స్ లలో ఫర్ ఎగ్జాంపుల్ యూ కెన్ లుక్ ఎట్ ద ఓవరీ కోలాన్ ఓకే దిస్ ఇస్ ద ఎక్స్ట్రా టిష్యూ పౌచ్ ఆఫ్ డోగస్ vulva perineum bladder uterus fallopian tube abdominal wall also even and these are the sites the tissue extra growth is attached in these sites. In 3 years back, I have one client. Okay, she have this uh, tissue where within the vulva, right? So it is very painful, very painful situation to her. The periods enter when intercourse done because these tissue have in the vulva. Okay, and now we are moving into the types of endometriosis. So I am going to touch just we want to create that awareness. We are not going to deep as a in the physiological process. Okay. So mainly types of endometriosis, if we can see now, three types will be there actually. But later it will be entering into the endometriosis. But before entering into, we can call as a diagnosis as a endometriosis. అంటే మనం ఎండోమెట్రియోసిస్ అనే డాక్టర్ డయాగ్నోసిస్ చేయకముందు ఇంకా త్రీ స్టేజెస్ లో ఉంటుంది అనమాట ఫస్ట్ వన్ ఈజ్ ద సూపర్ఫిషియల్ పెరిటోనియల్ లీషన్ endometriomas means ovarian cyst. So many of you heard chocolate cyst. बहुत सारे लोगों ने सुना होगी chocolate cyst. When you can read the client history, someone will have the cyst also that is the chocolate cyst. Okay, that comes in the ovarian cyst. Deeply infiltrating and laterally we can call the endometriosis. So what are the superficial means? Uh, Okay, superficial. Okay, superficial means when we can take the and above the tissue, right? So in that we can take the pelvic endometriosis, means in our area, genital area, that we can call the peritoneal lesions. Just one second, later I will show you. First picture where you are observed, na? Right, first picture, when we are taking that first picture, that picture is showing the peritoneal, means in fallopian tubes. Fallopian tubes లో ఎక్కడైతే రెడ్ ప్యాచెస్ ఉంది కదా, టిష్యూ గ్రోత్ కదా. ఓకే, సో దాన్ని పెరిటోనియల్ అంటారు. ఇంకొకటి ఓవరియన్, రైట్, డీప్ ఇన్ఫిల్ట్రేటింగ్ ఇన్సైడ్ ద యూట్రస్, deeply inside the uterus also. This is the very deeper level, and it will cause the pain also. And extra pelvic endometriosis means not only in our genital area, outside the area also. So what is that? Is the gastrointestinal tract, urinary tract, care endometriosis, vaginal endometriosis, thoracic endometriosis. Because these areas, urinary, that is extra growth will be there in urinary tract, we can call the urinary tract endometriosis. These are the extra outside, pelvic tissue outside है. Vaginal, right? Vaginal means in our outside, uterus का जो outside है. Where vulva place, this place is cause the very means very painful situation who are have this endometriosis. Thoracic endometriosis, right? So these are the extra, means in our lungs area also some people have this extra endometriosis. But most of the members think that endometriosis means only in uterus. No, these are the in different areas we have the different places this extra tissue growth will be there. So main important, what are the signs and symptoms? So signs say physically doctor will look at the signs and symptoms. But main, if you can look at main observe in your body, na, so you can that who are having this issue, they can have the pelvic pain. Means when they can sit or maybe when they can lying on the floor, right? So they have the certain type of pain in pelvic area. ఎప్పుడు కొంతమందిని చూసాను క్లయింట్ ని, ఓకే, పెల్విస్ ఏరియా ఉంటుంది కదా, పడుకుంటప్పుడు కానీ లేచేటప్పుడు కానీ ఒకలాంటి పెయిన్ వస్తుంది అనమాట పెల్విక్ ఏరియాలో, కింద ఏరియాలో. ఓకే, ఆ ఏరియా మొత్తం ఎలా ఉంటుందంటే యూ కెన్ ఫీల్ లైక్ టెండర్నెస్, అంటే ఎప్పుడు ముట్టుకున్నా కానీ ఒక పెయిన్ లాంటి ఫీలింగ్ ఉంటుంది. కూర్చున్నా కానీ లేవడం కానీ ఇబ్బందిగా ఉంటుంది. దట్ ఈస్ ద మెయిన్ థింగ్. అండ్ డిసమెనోరియా, కంటిన్యూస్ బ్లీడింగ్ అనమాట. అండ్ డిస్పర్యూనియా, అంటే యూరిన్ అనేది చుక్కలు చుక్కలుగా వస్తుంది అనమాట. ఓకే, సో దట్ పర్సన్ హ్యావ్ ది ప్రాబ్లమ్ ఇన్ యూరినేటింగ్ ఆల్సో. Dysuria, dysphagia, these all are the medical terminology. But in science, first they have the tenderness in genital area. Whole genital area have the tenderness. Means slight pain will be there. And main is the infertility issue. Because why they can have the infertility issue? Because when outside the area, when that tissue will be formed, na, so that person having scaring and addition. Actually I will keep in the very beautiful pic, but here picture that pics are missed. तो जो pelvis area होती है यूट्रस एंड pelvic के बीच में, they can cause the extra tissue growth ఉండడం వల్ల ఏమవుతుందంటే యూట్రస్ కి ఫ్రీడమ్ ఉండదు అనమాట, అక్కినట్టు ఉంటుంది మధ్యలో. సో దట్స్ వై దే కెన్ హ్యావ్ ది అడిషన్స్ అంటారు ఇన్ డాక్టర్ టర్మినాలజీలో. ఇన్ఫ్లమేషన్ ఎఫెక్ట్ ఎగ్ క్వాలిటీ ఆర్ ఇంప్లిమెంటేషన్. దిస్ ఈస్ ద most of the members, if they are not having any issue, they can have this issue because of that scar tissue. This inflammation, because chronic inflammation will be there in the body, na? So what will be happen? Hormonal dysfunction, because they are not release the egg, okay, on time, or maybe the developing of the egg, and later if they are developed egg, because of IVF also they are release the egg also, if they are using the extra source of hormones also. What will be happen here? Implementation, because for implementation also they need the uh, type of environment. Okay, if they are having the chronic inflammation, so that place is not giving that implantation का जो warmness होती है, right? So that is not will be there. And hormonal imbalance disrupting the ovulation because of this chronic inflammation. Next, abdominal bleeding already explained. Okay, premenstrual spotting, polymenorrhea, or menometerism means they are continuing having the 7 to 14 days. Again, after 15 days, they are having the spotting like that. Okay, and present in majority of the women with the endometriosis. If someone is having the infertility issue, so just you can look at whether you have these symptoms. When you are having intercourse, when you are urinating, when you are having the periods in first day, right? You have that pain or not. Just observe these things. These are the primary level, but in advance they have the ovarian cyst also that will be formed. In cyst also, chocolate cyst means that uterus and the tissue, sorry, that eggs tissue will be attached. So that will be formed like a chocolate type, means one big chocolate type. Already they have the PCOS issue, right? Polycystic ovarian. बट इसके साथ क्या होती है ओवरीज को अटैच होती है बिकॉज ऑफ दिस टिश्यू राइट एग इतना बड़ा एग हो जाती है बाद में दिस ऑल्सो अटैच विद द टिश्यू विद द फेलोपियन ट्यूब तो इसलिए चॉकलेट सिस्ट बोलते हैं इसमें मोस्ट ऑफ द मेंबर्स ऑब्जर्व माय फैमिली मेंबर्स आल्सो दे वेंट टू द सी सेक्शन मीन्स एक स्कोप एक लैप्रोस्कोपिक होती है वो उससे वो लोग रिमूव किया है बिकॉज unbearable stage है that stage and increased fourth stage like that है and ovarian problem very important thing ट्यूब्स एंड ओवरीज इसीलिए किसी का भी अगर नहीं हो रहे सो डॉक्टर विल रेकमेंड द हमको लैप्रोस्कोपी करके फेलोपियन ट्यूब्स को ऑब्जर्व करना है इफ दे आर फॉर्म द एंडोमेट्रियोसिस राइट इन फेलोपियन ट्यूब्स so how that way egg will be carried in the uterus so that is also called the infertility no? So that's why they can see the first fallopian tubes ovarian problems if they are in the ovaries the tissue extra tissue will be if we can see the microscope then only we can observe means very small but that will cause this much of issues anovulation ovulation ठीक की टाइम में नहीं होती है 14 day या like that and luteinized unruptured follicle जो luteinized phase होती है जो eggs का डेवलपमेंट होती है ना 14 to 28 days फॉलिकुलर फेज में है सेकेंडरी फेज ल्यूटिनेशन फेज में क्या होती है एक अनरप्चर्ड फॉलिकल्स मीन्स एग का जो क्वालिटी होती है फॉर एग्जांपल एग का 3 to 5 mm होना है बट दैट विल बी डिक्रीज मे बी 2 to 5 और मे बी ज्यादा एक ही एक ज्यादा होना है लाइक दैट ओके oocyte maturation defect means that releasing time will be affected and tubal problems peritoneal factors inflammation है body में sperm problems phagocytosis and macrophages inactivated by the antibodies ये वाला है outside of the body में endometrium luteal phase defect implantation defect implantation means जो एक sufficient environment होनी है आफ्टर द फर्टिलाइजेशन एनवायरमेंट क्रिएट नहीं होता है इसलिए उन लोगों को 1 to 2 days में पॉजिटिव दिखेगा बट आफ्टर 15 days they are showing the negative also because of the implementation नहीं हुआ and how it is going to be diagnosed so medical history and physical examination through the doctor and who are the healthcare providing and imaging test होती है ultrasound MRI and later laparoscope and gold standard for diagnosis right that is a बायोप्सी टेस्ट होती है ये वाला क्या होती है ना लैप्रोस्कोपी टेस्ट है बिकॉज दे कैन ऑब्जर्व ना तो गोल्डन स्टैंडर्ड है बिकॉज दे आर गोइंग टू ऑब्जर्व बट इन फर्स्ट सेकंड स्टेज इफ दे आर डायग्नोसिस ओके तो वी कैन टेक केयर अबाउट द पीसीओएस इसीलिए पीसीओएस जब स्टार्ट होती है ना why we are creating this much of awareness because when you are feeling something na just without any fear you can contact any healthcare professional. And stages one that is the minimal. Second, mild, moderate, severe, based on the lesion size, depth, and presence of the addition. When we can call the additions like round, tissue కు లావ్ అయిపోతుంది కదా వెళ్ళి లోపటి వరదాకా కూడా వెళ్తుంది అనమాట దట్ ఈస్ ద సివియర్ స్టేజ్ But in minimal mild stage, if we can take care, maybe we can prevent. So what are the treatment? First, that will be cause the chronic pain. So pain relief. These are the doctor. Hormonal therapy है, birth control. These doctor will take care. Remove the endometrial issue. I have seen in my family also. Uh, one ovary, right? One ovary is not working means one ovary is having chocolate cyst and another ovary have the healthy ovary. But infertility issues are there here sometimes, right? In secondary infertility, she done the chocolate cyst का जो laparoscopy किया है बाद में she conceived because that is removed. And very important, what we can do. These are the doctors. Now we are entering into the main important thing is that is the lifestyle modification. This is the very important. If you are using, क्योंकि इसमें कुछ भी नहीं है ना, जैसे बर्थ कंट्रोल है ये वाला है, ठीक है. इफ यू आर टेकिंग दैट आल्सो, बट लाइफस्टाइल मॉडिफिकेशन इज अ परमानेंट solution. In that, very important thing is anti-inflammatory foods. So for anti-inflammatory foods, what we can say, take the green leafy veggies, take the seasonal veggies, fruits, and lifestyle modification में stress का बहुत important role होती है when we are taking in the inflammation. Because this will be endometriosis pain will affect the psychologically also. Psychologically बहुत disturb करती है ना. That's why they can have the stress. So you can use the mindful techniques and barefoot walking, meditation, breathing exercise, all these will help you to stress management. First, you need to be create. This is a effort. It's okay. This is a body what we are created, but we need to now we have that chance in our hand, so we can reverse that condition also. Regular exercise. If we have so many Kegel exercise that will help you to increase the blood flow in the special and the pelvic area. So you can take consult any healthcare or maybe physiotherapist or maybe trainer. Otherwise, if you want, you can look at in YouTube and you can start the exercise. Right, especially on the pelvic exercises. If you are facing severely in the infertility issue. Yeah. And the anti-inflammatory already I have explained. Seeds, nuts, green leafy veggies, seasonal fruits, and vegetables. All these are comes under the anti-inflammatory. Anti-inflammatory means where your body is sick, you are going to do the alkaline condition. But focus on whether what time you are having, and which time you are taking, right? And what is the right food combination for you. तो इसके लिए आपको अगेन पीसीओएस डाइट में जाना पड़ेगा. सेम डाइट इज अप्लाइड हियर. And exercise also. Now we are going to the other complementary therapies. Acupressure will work wonderfully because some person have the, because acupressure क्या होती है, एनर्जी फ्लो बढ़ाता है ऑटोमेटिकली. Right? If they are not doing any exercise in that condition, do the acupressure, yoga. First, we need to calm down. Then only inflammation calm होती है. Then you can improve day by day. इसके लिए time लगेगा. But definitely, I have seen many people through lifestyle modification, right? They are improved at least 80 to 90%. कभी कभी होती होगी 90% they are improved. Their pain has signs symptoms. 90% they are improved. Herbal remedies, for example, ये वाला anti-inflammatory है. Turmeric milk, ginger water, right? Mint का water है. All these are the natural anti-inflammatory है. क्योंकि वो inflammation को कम करके soothing effect, तो will a soothing effect. And most important thing is nutritional counseling and psychological counseling. Why I mentioned counseling because follow up बहुत important होती है person to person. That's why I mentioned here nutritional counseling. Because some foods are preferable to some person, maybe some are not preferable to some person because they depending on the additional layer. Superficial है it's okay, but moderate है, but deep and depth में गई है up to organ तक. It will cause you so much of pain. And complications if you are not taking when you are faced with this issue. ठीक है, chronic pelvic pain होती है, infertility होती है, very painful, this is the ovarian cyst structure है, ये वाला होती है, एंड इमोशनल साइकोलॉजिकल इम्पैक्ट, ये बहुत इमोशनल इतना ड्रेन करती है ना, बिकॉज दे हैव एवरी टाइम पेन, इन बॉडी में कुछ पेन है, इधर कुछ पेन हो रही है, उधर कुछ पेन हो रही है, सो दे आर नॉट गोइंग टू एंजॉय देयर लाइफ, but anyone have the moderate, so just go and work with your coach, and ये वाला कंडीशन को डॉक्टर के साथ handle होते and living with endometriosis. So just build a support system. It's not a curse. It's a common. Okay. So but you need to be work on. Build a support system. Support system कहाँ से होती है? For with your family, maybe with your doctor, with your coach, with your trainer. These all are the support system. If you want, you can take the medical and emotional care. हम तो medicinal, emotional care we can do, medical we can do and consider that care. Tracking symptoms for better management. इग्नोर नहीं करना है, अगर ज्यादा सिम्टम्स है तो जस्ट वी नीड टू बी ट्रैक केयर द सिम्टम्स, एंड ये सब सुन के मेरे को सब है, जस्ट यू डोंट फोकस दैट मच, जस्ट लुक एट योर साइकिल। कुछ लोगों का ऐसा होता है ना, सब सिम्टम्स सुनने के बाद लास्ट टाइम पर्सन इज आस्किंग मी, मेरे को सब लगता है मैडम मुझे सब कुछ है, नॉट लाइक दैट, ओके, some are sometimes it's a normal, yearly 1 or 2 times it's a normal, but consistently you are facing more than 3 months, more than 6 months, so infertility is a, तो just focus on, आपको ज्यादा गूगल सर्च नहीं करना है, जिसको करना है उनके पास जाके कंसल्ट करना है। So thank you for this session. Just I want to share with you the, ओके, दीज आर द अदर है, ये वाला मैंने अभी तक जो लिया है इनसाइड, बट आउटसाइड का होती है ना कोलान, ये वाला है जो दैट हैव द इन डिफरेंट फॉर्म, तो उसके लिए भी आपको पेन होती है कभी कभी, ठीक है, abdominal वॉल, दैट इज द डिफरेंट थिंग। तो लुक एट दिस पिक्चर, ठीक है, ये पिक्चर देख लीजिए, वैसा होती है, जस्ट वन आइडिया, राइट, आउटसाइड द यूट्रस, लुक एट हियर, fallopian tubes, right, like this, just reaches. So anything you want to connect, just I'm sharing this slide. So any questions from this session? Members will be there. Any questions in this session? So just I'm going to share.
Ma'am, I have one question because
Hmm.
so many clients are asking this
Hmm.
who are coming for the PCOD.
Hmm.
Nowadays, frequently I'm hearing this removing of the uterus.
Hmm.
If they're facing small problems also, knowingly, unknowingly, they're taking a bit. Recently, in 1 month, I had 6 to 7 cases of removing the uterus.
Hmm.
In what we are doing the awareness sessions now. That's right. What your
Hmm.
insights about this? I want to hear from you.
Remove the uterus means it is depending on so many symptoms, right? So if someone is saying the remove the uterus, so you can take the secondary opinion, and if you are want to take a charge, just try to give yourself 3 to 4 months. Okay, try to give yourself 3 to 4 months. बट किसी का कंडीशन ऐसे होती है ना, रिमूव करने की कंडीशन होती है, बिकॉज दे आर इन द फिफ्थ स्टेज और मे बी फोर्थ स्टेज, दैट्स व्हाई वी आर क्रिएटिंग दिस अवेयरनेस सेशन। फर्स्ट है तो वी कैन इजली वर्क, सेकंड है so we will manage, right?
Yes, because if it is bleeding, it is continuous for 3 months, immediately the doctor is advised to remove the uterus. It is not consistently for not years together. For 3 months, they are observing it is a consistently, they are prolonging more than 10 days of a bleeding. If it is 1 week also, if they are going for the doctor, nowadays why they are suggesting. But if it is a severe, we know if it is a severe, much needed, we need to go. But small things also, if we can modify the lifestyle, we can what you say is right. 80 to 90% we can correct our lifestyle. We can overcome these issues.
Yes, we will manage this issue. But see, if they are having this issue now, before only they have the some symptoms,
Yes.
but they are not recognized because इतने inflammation है, bulky हो गई है, so that will be something will be there, but maybe they are not recognized. That's why we are saying diagnosis is also very important after the 35 nowadays. Okay, so can do the at least yearly once a scan, right? Pap smear test है. Means ये सब कुछ awareness के लिए है.
Yes.
Okay, if someone is saying na, so we need to look at those conditions and we can take the second opinion because it's not depending on one's opinion. It will be depending on
Because
opinion.
everywhere they will explain about the removal of the uterus, but complications nobody will. After removing the uterus, how they need to manage their further life, nobody will explain.
That's why we are there.
That's why, because it is awareness session, that's why I'm asking
Mm,
openly all these
yes,
questions.
yes, yes. Because if they can see that's why I'm saying who are watching on YouTube also, just share to everyone. At least we will create that awareness when they are taken the puberty. तो
Yes.
सबसे हम अवेयरनेस करेंगे ना इफ दे कैन मॉडिफाई देयर लाइफस्टाइल ऑटोमेटिकली लुक एट 30 years बैक इतना ज्यादा नहीं होती थी यूट्रस रिमूवल और अदर थिंग्स बट अभी क्यों हो रही है बिकॉज अदर थिंग्स विल बी देयर आई एम नॉट सेइंग स्ट्रेस है एनवायरनमेंट है एवरीथिंग बट लैक ऑफ अवेयरनेस आल्सो वन ऑफ द रीजन
Thank
थैंक यू महा फॉर आस्किंग दिस क्वेश्चन so no questions so just I'm going to share one slide because if you have any question so just contact on this number otherwise just comment on the YouTube is Nirja.
Ma'am, see, few people who are having endometriosis, they are going for DNC every time they're facing the problem.
Mm-hmm.
So how healthy it is?
That's why see most of the members can believe on the diagnosis also Nirja. Right?
Yes, ma'am.
So because that condition that pain have na, everybody wants to the quick result.
Yes, ma'am.
That is the main reason quick result चाहिए.
Mm.
So if they can remove also it's okay. I mean that pain, that time, or everything will be there, no? That's why. But
Mm.
when we are anti-inflammation is the one of the reason है इसके लिए. Because every PCOS सबको होती है but सबको endometriosis नहीं होती है, right? But किसी को
Yes,
PCOS
ma'am.
भी नहीं है, उसको endometriosis भी हो सकता है, इसीलिए. So PCOS नहीं है, they are have the healthy children. ठीक है, after 40-45 के बाद भी in menopause stage also they have the endometriosis because of the chronic inflammation. So all of you know that what are the reasons emotionally कितना सारा होता है inflammation body. So counseling, that's a nutritional counseling is mandatory because hurry में होती है, flight and fight में होती है. That's good. And here we are not saying anyone is correct or wrong. Just we are doing our work and we are creating the awareness. This I'm going to stop this screen share. And I hope everyone is here. So there is this is not showing. So now I'm going to end this session. Just I'm going to stop the screen share. And who are watching, just you can comment on the YouTube. And who are watched, just share because already we shared so much of things. So apply and enjoy your life. So now just I'm ending the YouTube live. Thank you all for joining today's session. And next week we are coming with the other speakers and with the other topics. So just now I ended this series, but For women especially, we are going to come every Friday. Every week we are having the new topics, and if you want to add the points, or maybe if you want to take this session, or maybe I want to learn from this topic, just mention in the comment box. And we are coming with the other coaches also. So every Friday I'm adding one session on this, especially on this channel. Thank you.
Thank you, ma'am.
Thank you so much.